wide berth to get here. So that's that. Hey everybody, welcome to another Sketch City Hack Night. I see some familiar faces here. Good to see y'all. My name is Jeff. If you have any questions about Sketch City and what we're doing and the projects that are going on and all that fun stuff, just let me know. Come find me afterwards. But today I'm really excited because I really think very highly of our speaker and the work that she does and the problem of air quality in Houston. So I'm not going to give a full-on bio, but please join me in a round of applause for Dr. Bakia Nelson.
Well, thank you all for having me tonight, and I'm very happy to be here. And let me just say before I get started, I think all of you in this room are brilliant. I already know it, and that you all are going to come up with some great ideas to help out with the issue of air quality in Houston. So I am the executive director of Air Alliance Houston. For those of you who don't know about Air Alliance Houston, I will tell you a little bit about us. Okay, I'm sorry. The clicker has a mind of its own. So Air Alliance Houston is a local nonprofit organization. Have you all heard of Air Alliance Houston prior to this? Yes? No? Okay. So we're a local nonprofit environmental advocacy group, and our main mission is to reduce air pollution to improve public health. And we do this in 3 different ways. So we do research, we do education, and we do advocacy as well. And so under the ways in which we do research, we actually, we either partner with universities, but we also engaged in our own community-based air monitoring. So for example, we have a project going on in Pasadena right now where we will take our own air monitors out to the city of Pasadena, identify pollution hotspots, capture air samples, get them analyzed, et cetera, work with the community, and then develop an action plan to try to reduce air pollution in a particular community. With regard to education, we have programs for K through 12. So we have Ozone Theater, which is an education program for K through 8. And we also have a high school curriculum that we're going to be rolling out this year as well. And that's a free service that we provide really to educate youth about air quality and issues in Houston as well. And then finally, we do advocacy, which is probably my favorite part of all of this, is taking all of these pieces of information that we compile and really using it to advocate for change and to really improve public health throughout Houston. And feel free to jump in as I'm talking if you have questions. So here's an example of our work, and I'll just talk a little bit about our project in Galena Park. Several years ago, we did an air monitoring study in the city of Galena Park. Are y'all familiar with Galena Park at all? The city of Galena Park? Okay.
Like the east end?
Yeah. It's a community along the Houston Ship Channel. It's called a fence line community, and what that means is that people that live in Galena Park are within a mile of refineries and other industrial facilities. So they have a very high exposure to air pollution coming from the Houston Ship Channel and the port as well. So we did air monitoring in 5 different locations: City Hall, Early Child Care Center, police station, and there were 2 other locations. But the basic outcome of this study was it showed that there were excess levels of diesel particulates for people in that particular community. And the results indicated that, number 1, the highest levels were at the Early Child Care Center, and that secondly, that the amount of pollution that was there was in excess risk of what was scientifically acceptable. I don't know why any level of risk is scientifically acceptable, but there is a threshold. So it was well above the threshold for cancer risk. So what we did, we used that information to advocate for an anti-idling ordinance, and we were able to get it passed in the city of Galena Park. So we wanted to get diesel pollution down, and one way to do that is by having diesel truck drivers not idle their engines. We also were able to use that same information to advocate for getting it passed in Jacinto City, as well as the city of Houston. So for those of you who don't know, if you see a truck idling, you can call 311 and report it, and they will connect you to who you need to be connected to report an idling vehicle. It's delayed. So I want to take a step back and talk a little bit about what public health is, because I think that people talk about public health and healthcare in the same way, and they're related, but they're different. So public health is really about assuring the conditions in which people can be healthy, and there's really a focus on community versus the individual. And what do I mean by that? So in medical care, you go to you get sick, you go to the doctor, and they diagnose you with something, and then you get treated. And public health is really about prevention. How do we prevent someone from getting sick in the first place? And a lot of that has to do with the community in which you live. So we've learned through research that your zip code is actually a stronger predictor of your health outcomes than your genetic code. So here's another example of, so if we think about clean air, an individual approach to addressing or trying to reduce air pollution would be to ask drivers, hey, could you just stop idling your engines? A community level approach would be to implement an ordinance that says, no, you can't do this, you can't pollute the air. We know that this is a strategy that works. We know that we'll get pollution levels down, and therefore we are implementing a regulation that says we can't have you idling your engines. So that's the difference. So now you have a population level impact when you do that versus an individual impact. So what do you all think makes someone healthy? I think I gave y'all the answer though.
Clean air.
Clean air, absolutely. Ice cream, that can at times improve your mental health for sure. So what the U.S. public thinks, this was a survey that was done several years ago, and in general, we tend to think, because a lot of the discussion in the U.S. is focused on healthcare and access to healthcare. And so most people, 86%, think that your personal behaviors, right, and also your access to healthcare, 73%, are really what influence your health outcomes. And really, we know that that's not the case. So these are called social determinants of health. But really, what this is about how your environment really influences your health. So this piece on this infographic, that's your physical and social environment. And that's really the largest chunk of what makes up or what impacts your health. And really, your social structure, your social status has an influence on your physical environment. So if you are in a lower income community, you're more likely to be exposed to a refinery or other sources of air pollution in your community. So those are some of the factors that really play into producing health at a community level. So here's a map of differences in life expectancy across the country. You can also see these differences, this is differences by state at the county level, but you can also see these differences in communities that are just 2 miles apart. So for instance, in New Orleans, there's a 25-year difference in life expectancy between 2 communities that are about 3 or 4 miles apart. Okay? So they're very pronounced differences due to the environmental conditions. Any questions so far? All right, so air quality concerns in Houston. I'm really gonna focus on 2, but we know that we live in the largest or near the largest industrial complex in the country. Our entire east side has multiple sources of air pollution. We've got trucks coming in and out of the port. They've also got a ton of industrial facilities. And then we also have communities living in very close proximity to these facilities, which is a major issue that a lot of cities don't have because they have implemented zoning. So we've known since about 1915 that people should not live near industrial sources of pollution. And that was why zoning came about, to separate land uses, to separate people from environmental harm. Concrete batch plants, I'm gonna focus on two things today. Concrete batch plants, who knows what a concrete batch plant is? If you've been talking to me in the past couple months, you've probably been bombarded with concrete batch plant talk. But a concrete batch plant is a facility that produces concrete, right? So they bring trucks in with cement, and then they aggregate it together, and then they produce concrete, and then they take it to the project site. Well, so two things are happening. One is because Houston has no zoning, concrete batch plants can really locate themselves in residential areas. But secondly, the Texas Commission for Environmental Quality permitting process also does not account for having multiple environmental hazards in a particular community. So what has happened in some communities is you have a facility, you have 5 facilities on one street, right? And I'll tell you a little bit about what the problem is. So the cement industry is the 3rd largest industrial source of pollution. I'm not going to focus too much on the cement side of things, but on the concrete batch plant side, the main issue with concrete batch plants is the dust exposure. And they are supposed to have equipment in place to reduce the exposure to the community. However, we know that they are not putting the proper equipment in place, or the proper tools that they have in place to reduce the exposure to the extent that they can. So again, the issue with concrete batch plants is really the fine dust. And there are more and more studies coming out that's showing just how dangerous fine dust is. And I don't know if you can see what this says up here. This is the diameter of sand, right? So we're talking about dust that's about this, or smaller than this. Okay. So the dust that comes from facilities and other sources are so fine that they can bypass the body's defense mechanisms. We can breathe them deep into our lungs, and they can also get into our bloodstream as well. So the most recent study that just came out, which included 60 million people and followed them over multiple years, has found that there is no safe level of exposure to particulate matter. Right? So we should be doing as much as we can to reduce particulate matter levels. And here are just some of the health effects of being exposed to particulate matter. Early death, cardiovascular harm, respiratory harm, and some may cause cancer. Excuse me, depending on the source of particulate matter, it can be made up of different types of compounds. Right? So in cement dust, there's silica, which is cancer causing. So here are some of the residents' concerns that we are trying to help with now. This is a tree, I don't know how well you can see it, but this is a tree that's on the front yard of one of the communities that we're working with. And that just lists out dust, smoke, truck traffic. You know, there are broader issues other than air. We focus on the air aspect of it, but in terms of quality of life in a community, these facilities are permitted to operate 24 hours a day, 365 days a year, if they so choose. Not every facility does this, but they can if they want to. And then there are other, and obviously if you're operating 24 hours a day or starting very early in the morning and you're in a residential community, you're disturbing the quality of life. So a lot of people are losing sleep and just having a very hard time with these facilities. So how do we know it's a problem? City of Houston did an investigation last year. of about 35 different concrete batch plants, and they found over 40 violations, and the main one being the lack of adequate dust controls. So the communities are being exposed to fine particulate matter at a level that they probably should not be. And one of the things that I wanted to note about this is there's one resident in particular. She had an op-ed actually in this last Houston Chronicle, and if you're interested, y'all can look it up. And she has horses on her property. She's had to put one of her horses down. She has pecan trees on her property. Her pecan trees are no longer producing. So there are multiple impacts, not just human impacts, but environmental impacts on vegetation and also on animals as well. So this is a map of concrete batch plants by council district. Council District D has the most, 18 facilities. Can you all see this? And as you can see, there are about 180 concrete batch plants throughout Harris County. We have the most in the state of Texas, twice as many as Dallas. And we get applications every week to our office. We have requested all TCEQ era permits, not because we're approving their permits, but we get all the applications that go to the TCEQ. They come to our office. So there are applications coming in every week for new ones, for new facilities. And this map just shows the air monitoring sites. So, and I have to say we didn't include ozone monitors, but what we wanted to look at was where are the air monitors that monitor for PM 2.5, the particulate matter that we're interested in, relative to where the concrete batch plants actually are. And so we calculated that the average distance to a facility from a PM 2.5 monitor is about 10 miles. So we really don't have good data on what people are really being exposed to because the average distance is 10 miles away from a particular site. We also did an analysis of concrete batch plants in proximity to schools, and so we wanted to know, are there schools being exposed? And so we found that there are about 40 schools in HISD that are within 1 mile, and we found 8 schools within a half a mile. Now, there was a study done a couple months ago by Rice University that looked at asthma attack rates in HISD schools. And they ranked these different schools, and they put them in one of they have more results than this, but the one I'm focusing on is that they categorized schools by whether they were high asthma rate zone or not. And I just got the data just a few days ago, so I haven't had time to really delve into it. But what I do know is 4 of these 8 schools are in the high asthma rate zone. So it's likely that what I would do with that information is take that information and reach out to those schools and start to have a conversation about what types of impacts, if any, they've had. Meaning, do they have dust at their school? Is from their perspective the concrete batch plant an issue, or has it become an issue? Was it ever an issue? So those are the kinds of ways we use data to really hone in on an issue that we're trying to help the community with. That's the op-ed that I was referring to. At my last presentation, I actually read it, but I won't do that to you guys. And this is a community that I'm learning about now, Super Neighborhood 41. I just learned about what's going on there just a few weeks ago, so I don't know very much, but I wanted to share it with you just as an example of the fact that we still have, even outside of the Houston Ship Channel, we have communities that are surrounded by toxic facilities. So really, neighborhoods are where poverty, race, ethnicity, and other social factors really converge with the physical environment to really produce our health outcomes. And I will show you what I mean by that. So residents in Super Neighborhood 41 have filed over 3,000 complaints with TCEQ over the past few years related to their air quality concerns and others, but including air quality. Since that time, TCEQ has conducted air samples at 9 sites, but they did so for only 1 week. And this is the community. So there's a big landfill here, and then you've got other facilities, and all of the facilities are in red. So these are all potential sources of environmental, air pollution. And one up here. All
Or do you know what, like, what's it called? Which streets stuff?
I'm sorry.
The streets.
Oh, this one of these roads is called McHardy Road, I believe it is. Yeah, I went to a community meeting there last Thursday, so I don't know too much about it personally, but this is just what I'm starting to dig into. All of this here, these are subdivisions. Right? So there's one subdivision, in fact, and this is another thing I want to point out. Here is their closest air monitor. It doesn't, this is an ozone monitor. It does not monitor for air toxics. So then we looked at, well, where is the closest air toxics monitor, right? The closest one is to one of the subdivisions, Southwest Crossing, is 5 miles away. But Shadow Creek Ranch, the reason why this one is really interesting is because Shadow Creek Ranch has 7 facilities within a 2-mile radius of the subdivision. And they are the farthest away from an air toxics monitor.
How much does an air toxic monitor cost?
Good question. So you have different types, and also for there are 2 different categories. So there's a federal reference monitor, and then there are monitors that you and I probably could afford more so than a federal reference monitor. So the monitors that are in the air monitoring network, they can go up to $20,000, $30,000. Just to maintain a monitor is in the thousands of dollars. However, that being said, for instance, like our air monitors, you can get an air monitor for $5,000. However, it's not comparable, at least from a governmental perspective, because it's not a quote unquote federal reference monitor, if that makes sense.
How difficult are they to build? Like, if you want to just get models where
Well, actually, what's going on now in terms of technological innovations is that people are trying to build really cheap really cheap monitors for exactly that reason, to make them more accessible to the public. So now, for instance, you can get an air monitor maybe for $250 or $500, and it really just depends on the quality of that monitor and what you're looking for as well. But there are lots of projects that are popping up all throughout the United States where researchers are developing these cheaper sensors, cheaper air monitors, I keep saying sensors. Another interesting thing that I just learned about is that they are now there's a company that has made asthma inhalers with GPS sensors in them. And Air Louis, it is something I'm trying to get funding for to do here. But Air Louisville is an initiative where they work in partnership with different organizations, and they've distributed these asthma inhalers to different to adults who had asthma, and they were able to identify in the city where their asthma was being triggered using those asthma inhalers. And so now what the city can do is go to those hotspots that have been identified as inhaler hotspots and try to see, is it an environmental trigger? Is it indoor? Is it outdoor? And try to work and implement strategies to address asthma triggers. So there's some really exciting things going on to be able to address some of the issues that we continue to face. I always include this study in this in my presentations because it was a study that reviewed 94 other studies looking at
Study band,
a meta-analysis basically of residential proximities, environmental hazards, and adverse health outcomes. And we know, we have enough science to know that people should not be living next to environmental hazards. We don't need any more studies. We don't need any more studies to act, I should say. We need more studies to continue to better understand, yes. But we don't need any more studies to be able to say, you know, we need to move forward as a city in terms of where we permit environmentally hazardous facilities to locate. So these are just some of the ways that, and I've described it, so I won't spend too much time, but these are some of the ways in which we are working to try to address some of the issues that I've just talked about. I am working with Jeff to develop an interactive map, so hopefully I'll come back and you all can view the map and give us feedback on the map once it's developed, to really develop a tool that residents can use. So you would be able to type in your zip code, you would be able to see what facilities are in your neighborhood, you would be able to overlay your council districts if that's what you wanted to do. And then really start to learn more about the facilities. So we'll include complaint data, we're going to include emissions data, a lot of data to give residents an opportunity to use that information and know what's in your community, and then take that information to your council member or wherever you want to take it to try to do something with that information. So some of the policy options that we've been exploring to address some of these is having the city put in its sales contracts that the land cannot be used for an environmentally hazardous purpose. So it's fine to have a business, but it can't be an environmentally hazardous business if it's in a residential area. And then also looking at how can we prohibit developers from developing environmentally hazardous facilities in residential areas, near schools, hospitals, and so on and so forth. I should have added on there and hacked. So these are some of the ways that we can help to improve air quality in Houston. Voting matters, obviously. Report air pollution directly in your community, and that's something that I'm hoping that the tool can help with as well. You know, sometimes people don't know exactly who to contact. You'll be able to see who your elected official is and what the contact information is for that person. Make public comments, communicate with the media, do op-eds as well, and get involved with Airlines Houston as you are tonight. So that's it.